In this lesson, you will learn about the 11.4.1 changes to the clinical desktop. Lesson activities include watching a demonstration, then building your skills in a practice scenario. When ready to begin, click Continue. We are starting on the clinical desktop with our patient Amber Allscripts already in context. By using the full screen button, we have merged the two panes together on the clinical desktop. The first tab in this view is the Vital Signs Findings. Most of the Vitals tab items have remained the same. However, there is one new feature related to goal setting. A goal can be set for each vital item listed in the item name column. As we enter in vitals for Amber's visit today, let's also set a new goal. The first step to enter vitals and goals is to click on the heart icon located in the clinical toolbar. The Vitals Order Details window displays. Notice the Order, Results, and Goals tabs located above the Vitals section. We will set goals in a moment, but let's first enter Amber's vitals. We have entered Amber's vitals. Now let's set a goal weight of 75 pounds to be measured in 6 months. The first step is to select the Goals tab. The Goals section now displays in the Order Details window. Notice the Goals and Goals History hyperlinks. These links correspond to the Goals section and the Goals History section in the pane at the bottom of the window. To add a new goal for Amber, we must first select the drop-down arrow in the Add Goals field. Next, we need to select the goal we wish to add. In our example, we will select the weight goal. Once the goal is selected, the goal fields display. The goal fields can be entered on this screen, or we can click on the Edit icon to enter information. For this example, we'll use the Edit icon button. Fields for our goal now display. First, we'll enter the reason for the goal. Using the drop-down arrow to the right of the For field, we'll select Health Maintenance as the reason for Amber's goal. Next, we'll select the option that describes whether we want the target goal to be less than, greater than, or equal to the target. To set this value, we'll use the drop-down arrow to the right of the operand field. The list of values displays. In our example, we want Amber's weight to be equal to 75 pounds, so let's select the Equal To value. Next, we need to enter the target value. We can enter the value by clicking in the target field and typing the number, or we can use the calculator icon to the right of the target field. Let's enter the target weight of 75 pounds. Now we'll complete the Type field. The Type field defaults to numeric, which for our example is the correct value. The drop-down arrow to the right of the field is used to change the type value when needed. The Baseline field is used to enter the starting point of the goal. In this case, Amber's current weight is 78 pounds, so we'll enter that number in this field. The Start field defaults to today's date. To change this date, use the calendar icon and select the appropriate date. For our example, we'll accept the default of today. The Duration field is populated with the amount of time the patient has to reach the goal. Let's say we would like Amber to reach this goal in 6 months. The duration is entered by either typing in the number or using the up and down arrows to the right of the Duration field. We'll enter 6 in the Duration field. After populating the Duration field, the next field automatically populates with the value of months, and the Due field displays the due date of the goal. If the duration is not months, you would use the drop-down arrow to the right of the field to change the value, at which time the Due field would correct based on the new selection. In Amber's case, months is the correct option, so we'll accept the default. The Confidence field is the level of the provider's confidence on a scale of 1 to 10 that the patient will successfully complete the goal. We will set the confidence level to an 8. The last two fields to complete when setting a goal are the Managed By and Tracked By fields. In our example, Provider Allscripts will manage and track this goal. To identify the Provider Allscripts, we can either use the drop-down arrow and select the provider from the list of values, or use the binocular icon and perform a search. In our example, we will use the drop-down arrow and select the provider from the list of values. All of the goal details have been entered, so we will use the OK button to save the information. We have returned from the Edit screen and are now back on the Goals tab. The information we entered now displays. To enter additional goals, you would use the drop-down arrow to the right of the Add Goals field and repeat the process. Notice the results history section at the bottom of this screen. This area is used to view the results of goals set in the past. For our example, we are finished adding vitals and goals, so we will click the OK button. We are back on the clinical desktop. Notice the new column titled Goal. In this column, we can see the weight goal we just set for Amber. A new goal can be created by clicking on the new link in the goal column for the corresponding vital sign. Next, let's review the changes on the Health Management tab. The Health Management tab now displays. A new view called Medication Flow Sheet is now available in the HMP tab. The Medication Flow Sheet view allows you to view and filter a patient's entire medication history. We can access the flow sheet by clicking on the drop-down arrow in the View field and selecting Medication Flow Sheet from the list of values. The Medication Flow Sheet displays. We can now see all medications for our patient. Funnel icons located in the medication name, problems, and status fields are used to filter the medication information. For our example, if we wanted to see all medications prescribed for Amber's cough, we would click on the funnel icon in the Problems field. A list of all problems displays, allowing us to select the appropriate problem or problems. Multiple items can be selected when filtering the medications list. A blue check mark identifies which problems have been selected. Once selections have been made, the Apply Filter option is used to filter the medication information. The filtered medication list now displays. We now see only medications that have been prescribed for the cough problem. To remove all filters and show the complete medication history, the refresh icon is used. The entire medication history now displays. In addition to the Medication Flow Sheet view in the HMP tab, the growth charts now include World Health Organization standards, prematurity, and Down syndrome needs. To view the growth charts, we'll click on the drop-down arrow in the View field and select Normative Growth from the list of values. The Normative Growth chart displays. The view defaulted to standard 2 through 20 years based on Amber's current age. To view either the prematurity or Down syndrome growth chart, you would click on the drop-down arrow to the right of standard, and the Normative Growth chart options display, allowing you to select prematurity or Down syndrome. This completes the review of the HMP tab. Let's click on the Problem tab next. Let's take a moment to review the columns in the Problem tab. The first column we'll review is the Assessment column. In the previous version of AEHR, problems were added by clicking on a checkbox, which caused difficulty differentiating between assessing a problem and reporting a problem. In version 11.4.1, the Assessment icon has been added. We can see the assessment icon in the ACI and here on the clinical desktop. To mark a problem as assessed, we simply single-click the assessment icon. The green check mark appears, making it easier to determine that the problem has been assessed. In our example, Amber is back in the office today due to a cough. We can indicate the cough is being assessed by clicking the assessment icon. Next to the assessment icon is the one-click edit pencil icon. Clicking on the pencil icon prompts the Problem Details window to display. Let's click on the pencil icon to review the Problem Details page. In our example, we'll click on the pencil icon related to cough. The Problem Details window displays. The status field displays at the top of the window. The status field indicates if the problem is active, resolved, denied, or enter an error. The drop-down arrow to the right of the status field is used to change the current status. To get a better view of the remaining sections of the Problem Details window, let's zoom into this screen. We have now zoomed in on the Problem Details window. Navigation hyperlinks have been added horizontally across the top to allow you to quickly move from section to section within the Problem Details window. Notice the Details option displays in bold. Bold hyperlink indicates this section is currently being displayed. In the middle of the Problem Details window are the Impressions and Current Impression fields. These fields are similar to annotation fields in that once the information is saved, it cannot be edited. The impression fields are intended to document changes from encounter to encounter for ongoing chronic problems. A provider can choose to copy forward the last impression, by clicking on the Copy Last icon. The Impression History hyperlink at the top of the window is used to view the previous 8 impressions. Version 11.4.1 provides a way to indicate who is managing the problem for the patient, as well as whether or not the provider is a referring provider. To enter a provider, you can use the drop-down arrow to the right of the Managed By field and select the provider from the list of values, or utilize the binocular icon to search for the provider. The radio buttons to the left of the provider and referring fields are used to indicate if the provider is referring or not. The provider's name displays on the clinical desktop for easier identification. The onset date, resolve date, and suppress on resolve fields have remained the same but have been moved for easier access. Let's move to the Additional Details section by clicking on the Additional Details navigation link. We are now viewing the Additional Details section of the Problem Details window. In our example, the severity, clinical progress, type, and identified by fields have already been completed. The drop-down arrow next to these fields is used to change the value when necessary. We have moved to the Assessment History section of the Problem Details window. In our example, this appointment is the first assessment for the problem. The Assessment History section can include history of up to 8 assessments. If there are more than 8 assessment history entries, a hyperlink would be available to display the additional entries. We previously mentioned the impression history, and the annotations works the same as in the previous version, so let's move on. To close the Problem Details window and return to the clinical desktop, we'll click on the OK button. We're back on the Problem tab of the clinical desktop. The next column is the Name column, which lists the name of the problem. Notice the column is broken up into 2 sections, My Priorities and Other Problems. In 11.4.1, providers can set problems as My Priority. Once a problem is set as a priority, that problem will appear in the My Priority section for all patients. There are 2 ways to add or remove problems from the My Priority list. The first way is to click and drag the problem from the Other Problems section to the My Priority section, or vice versa. Additionally, you can right-click on the problem and select Add to My Priority. The problem Asthma Cardiac is now listed in the My Priority section. With 11.4.1, there is an option to see only one or both the ICD-9 and ICD-10 codes. Currently we can see both, but this option could change as we transition from ICD-9 to ICD-10 codes. In some cases, a blue plus sign will display next to the ICD-9 and/or ICD-10 code. These blue plus signs indicate that there is a secondary code. By hovering the mouse over the plus sign, the primary and secondary codes will display. As mentioned earlier, the Managed By provider can be seen here on the clinical desktop. The Managed By field lists the provider's name and specialty related to who is managing the problem. The Last Assessed column lists the date of the last assessment and the name of the provider who conducted the assessment as well as their specialty. This completes the review of the Problem tab. Let's move on to the Meds tab. In version 11.4.1, the Medication Viewer has been improved. The viewer groups and lays out data so that it's easier to read. To open the Medication Viewer window, you would right-click on the medication you want to view, and then select View from the list of values. The Medication Viewer window opens. Notice the navigation links available across the top. These are used to navigate more easily through this window. In the Medication Viewer window, we see a new section called Order and Renewal History. To more clearly see this new section, we'll zoom into and review the section details. We have zoomed into the Medication Viewer window. In the Order and Renewal History section, we see the medication we selected from the Meds tab appears in blue. If this medication had been ordered previously for amber, we would see the last 10 medication orders. If there were more than 10 actions for this medication, we would have the option to view all activity for this therapy by selecting the link above the medication. Both name brand and generic medications would display depending on the original prescription. To differentiate between similar-looking drug names, the names are written using Tallman lettering. In our example, we have only one action for this medication. Placing the cursor over the action column of any medication prompts a detail window to display outlining the order details for that medication. This completes the review of the new order and renewal history section of the medication viewer, so we'll close the detail window and return to the medication viewer. To close the medication viewer, you would click on the Close button in the upper right corner of the window. We have returned to the Meds tab on the clinical desktop. This concludes the demonstration of the AEHR 11.4.1 upgrade changes to the clinical desktop. You are now ready to proceed to the practice scenario.